This is Jacob, and Jacob came. He was unhappy with his smile and didn't like the crowding. And you can see if you look at the case, he's got a lot of crowding and a lot of teeth out of position. And I think a lot of doctors might just be a little bit like, whoa, what do we do here with this case? And be a little bit more concerned about the complexity of it. And a lot of times my patients come in that they say they had a consultation and they were told like Invisalign wasn't even an option, that they had to do braces or surgery and things like that. And so I wanted to show you this case because, believe it or not, this case can be done really easily just by using some basic maneuvers of expansion. We got this case done in 2 rounds of Invisalign with a total treatment time of 7 months, which sounds crazy, but Invisalign is a great tool, and if you know how to use it, you can get really predictable, really great results for patients, and patients like it when it's fast and easy. So one thing that I do when we're doing our Invisaligns is I actually use a lot of 3D software and move all the teeth myself. We use movements that are more predictable with Invisalign. Also, I'm going to be balancing things to get the right aesthetic and functional result. Most of this crowding is just caused from a lack of arch size, and so we want to focus on expanding and widening the arch. And when you do that, it's better for function, it's better for airway, it's better for sleep, it's better for all the things, but you're also creating room for the teeth. And as soon as you start kind of widening things to how Jacob is kind of built to live from a functional perspective, things kind of just fall in place. This is where we started, and you're going to see again, these look like they're very far back and they're going to be really difficult to treat, but the reality is once you make room for them by expanding what's called the buccal corridor, which is here to here, everything should just slide into place. And same thing goes for here. You're going to look like there's not a lot of room for these teeth. What we're going to also do is expand the arch. Now we're expanding both arches, and that's important because you can't expand the lower without the top. Otherwise, you'd end up with a bite issue. There was no extractions or anything done for this case, and I think that's something that sometimes a lot of doctors recommend to quote unquote make room, but I'm a bigger fan of wider, more fuller arches. It's better for function, and also it looks better. After the first round, which we were able to get a lot of improvement through expansion, and then the second round we just did a little bit of cleanup. So you can see if we go from here to here, from here to here, and you end up with a really, from here to here, you end up with a really, really happy patient who's super confident, super happy with his smile. It's a bit of a life-changing result for Jacob. He's thrilled because Invisalign was quick, 7 months, and it was easy for him to do, and you end up with a great result.